Hi, my name is Peterson. I'm a reproductive endocrinologist at Pinnacle Fertility in Arizona. Today we're going to discuss male infertility and some of the myths surrounding it. Myth number 1, infertility is a woman's issue. While it is true that women carry most of the important equipment and do most of the hard work when it comes to reproduction, in up to 50% of the cases, there's a male component to infertility. In up to 30%, it's the only identifiable cause. Conditions like oligozoospermia, or low sperm counts, asthenozoospermia, low motility, or salmon that don't swim upstream, so to speak, and teratozoospermia, or misshapen sperm, can all make it harder for sperm to reach and fertilize an egg. Myth number 2, age doesn't affect fertility in men. While it's true that men can father children later in life, it doesn't mean that age has no impact. In fact, studies show that men over 40 are often found to have higher rates of DNA fragmentation in their sperm. This can be associated with infertility and miscarriage. Advanced maternal age is also associated with higher risk of autism and schizophrenia in children. So yes, age matters for men too. Myth number 3. Lifestyle doesn't affect sperm health. Actually, our lifestyle can affect our sperm health. Smoking, excessive alcohol consumption, lack of sleep, obesity, exposure to toxins and heat in our environment all can lead to negative effects on our sperm health. So what can you do? Well, first, if you smoke, stop, both tobacco and marijuana. Avoid excessive drinking, limit it to 1 to 3 in a week. If you are overweight, work on your diet, work on exercise. If you aren't taking an antioxidant supplement, it might be worth considering one. Avoid saunas and hot tubs or other sources of heat. Myth number 4, men don't need to check their fertility until they're trying to conceive. Being proactive can save time and heartache. Because we don't diagnose infertility in heterosexual couples until they've been trying for a year, assuming that the female has regular cycles, that means you could be trying for an entire year before you find out that you have significant abnormalities in your own sperm. A semen analysis is simple. It's non-invasive. It's an easy way for us to find out if there are abnormalities early on, which allows us more time and options for treatment. Myth number 5, taking testosterone will improve men's fertility. This one is a big misconception. Taking testosterone via injections, gels, or implants will reduce sperm production and may even shut it down. When we give you exogenous testosterone, your brain recognizes that it has the end product and stops sending signals to the testicles to produce testosterone. Those signals are the same ones responsible for producing sperm. When you stop testosterone, it's true that most men will see a return of spermatogenesis, but that takes time. It can be a minimum of 3 to 6 months, and for some men it may take up to 2 years. A small percentage may never see return of spermatogenesis. So consider carefully before starting any of these types of treatments. If fertility or childbearing is important to you, you may want to avoid it altogether. If you truly need this therapy, you may want to consider freezing sperm ahead of time before starting. This has been Male Infertility Myths. Thank you for spending the time with me, Peterson, reproductive endocrinologist at Pinnacle Fertility in Arizona. Take care.